My name is Gina-Chiwela, and I work with People's Action Forum in Zambia. These circles that we create in rural communities are adult learning groups in which people come together to identify their own issues, what is going wrong in our community, and what can we do about them. The circles are a learning process which starts with the identifying of these issues, right through to people deciding what should we do about our problems and how do we do it. We find that in our literacy programs, the main issues are HIV/AIDS, their children's education, and broadly poverty, which we find are all related issues, of course. We begin with, once people have identified the issues they want to deal with, and the fact that HIV/AIDS is an issue that is touching every part of their lives, begin with a discussion on how their lives are being affected. And through these discussions, we find people now are able to think about how do we prevent HIV/AIDS, or how do we deal with the fact that it is affecting us, affecting our community. And within this process also, they begin to identify some of the challenges in dealing with HIV/AIDS. And almost invariably, we find that literacy is one of those issues. The fact that people are not able to read or write, they cannot access information that they need to help them deal with HIV/AIDS. And further down the road, once they have this information, they have more access to it. They find that if they need to go on treatment, some find that because they're not literate, they cannot follow their medicinal regime properly. They're not able to sometimes understand, and they have to ask someone else to help them with following their regime for their medication. And so we have then the direct link between the two, where now the communities themselves are asking for literacy programs or extending their literacy programs. We have also found that our facilitators come back to us and say when they take messages of prevention, they find that communities that are more literate accept the messages a lot more easily. And so the process is a little quicker. And so even from that end, we have found the people that are facilitating in the community groups asking for more literacy to be brought to the people, because it helps people uptake the messages on HIV much, much more. We use an approach called Reflect, which is an approach to adult learning and social change. Reflect is a process in which people are helped to deal with issues at their own pace, in their own time, and with regard to what they feel is most important. And it has been found that Reflect helps people then to be more open even about sensitive issues like sex and death. And in our communities, culturally, those are not matters we talk about publicly. But through this process, we found that people have become more and more readily able to talk about the matters of sex, death, HIV/AIDS, and even stigma. What is stigma? If we behave a certain way, does it alienate a person, or can we help them better if we draw them close? And so the approach in having people connect what is happening in their everyday lives to being able to read and write, and how that affects how they deal with information that will help them deal with HIV/AIDS. We find that now people have become much more open, and beyond what we are hoping for them to do, we find now communities asking us. We have been taking messages of HIV and VCT. We get back the question, okay, so now I know my status, then what? What do I do? And so that has now driven the program to a point where they're not only accessing the VCT, but because many of them are living in the communities we're working with, live in remote areas, up to 35 kilometers from the hospital. We were able through this process to help them now access mobile VCT, to bring it to the people. once they knew their status, their difficulty was how do we get CD4 count. We could only do that in the main clinic, which was transport costs were too much for them. And so through the program, and us working very closely with the local health center and the hospital, we're able to bring these services to the people. The local health person that works with us goes into the area, does the VCT, does a CD4 count, and whereas before they would have to wait even up to 2 weeks to get their results, now we can take results back to them within 2 days. The prize that we have received will help in the information access for the facilitators and even the general community. People's Action Forum has a resource center for the community where they can get their reading information. We would want to set up an internet access point, and where they can also just get information on different issues concerning their health and literacy itself. The prize also will help with bringing in materials for training the facilitators, because this is one of our challenges, is getting our facilitators also building their capacity to help their communities. So the materials that we will produce from this prize will help them do that. Yes.